Hi everybody, this is going to be your introduction to the course, and I thank you for your patience. I'm sorry that I can't be here, but hopefully I can get some of your questions answered and provide a discussion board for you to ask questions should you have any. So this is a health assessment course where you are going to learn how to properly assess patients. Some of you may have experience with assessment if you've been to another program, or perhaps you're a practical nurse already. Our program does require that everybody take this assessment course. There was a study done a couple years ago where it was shown that there were some pretty low scores in the area of assessment on the NCLEX. So HAC developed this course a few years ago, hopefully to increase the skills of our students, and it actually has worked. We've gotten some good feedback. So the course introduces you to health and physical assessment of clients and detection of findings which indicate an abnormal condition. And one thing I want to make sure that you know, there is more than one way to assess. So as we're going through some of these processes, you may say to yourself, well, I learned this a different way somewhere else, and that's probably true. So there is more than one correct way to perform an assessment. So keep that in mind. Even if it varies from something that you've seen before, it doesn't mean that it's wrong. And here's another thing that's a news flash for you. I don't know everything, and I think that's exemplified right here by the fact that I misspelled the word everything, and I didn't do that on purpose. So I don't know everything. You may ask me a question and I don't know the answer to it, and that's okay. I will either find out, we'll figure it out together, but just because I'm a nurse with a lot of experience doesn't mean that I know absolutely everything, and there have been times that students have introduced a new technique to me that I didn't know about before that worked even better. So just keep that in mind, that I learn many things along with you. My contact information is in the syllabus, but I have it here for you too. I prefer email first. I'm the fastest at responding to email over anything else. I do not routinely check phone messages from home, so if you need to get a hold of me right away, off hours, email is the best way. My phone number's there. You can always leave a message. My office location is right in the nursing office in Main 215H. I do have office hours Tuesdays from 2 o'clock to 4 o'clock and Thursdays from 8:30 to 11:30. If you need to see me and those times don't suit you, please don't hesitate to reach out to me. We'll figure something out. I don't want somebody to say they didn't come see me because they couldn't fit into my office hours. If I don't answer an email within 24 hours, I probably didn't receive it because I'm pretty prompt at responding to emails. So you may be wondering to yourself, what exactly do I have to do? Meaning, what is she going to check on? What do I have to do? Well, you do have the reading resource list that I put in D2L for you that tells you each week what readings are due, and it should always be done ahead of time, and what workbook applications you need to do, and also what you need to do within ATI. Now, this is in addition to what you have to do online if you're in the blended course, which all of you are. Now, I'm not going to quiz you on whether or not you read. I am not going to look at your workbook pages to make sure that they are done because you're adults and you can handle that on your own. What will happen, however, is if you choose not to do these things, you may struggle. So when I have students who score low on exams and we sit down to talk about it, I find that they thought they could get through the class by just showing up, and you really can't. You need all these resources to help lift you to a higher level of understanding. So the tools that you have are the classes, the reading, the workbook, and ATI. If you only use the classroom work, that's only 1/4 of the tools that you're given to be successful. So keep that in mind. Now, with the workbook, we will go over some things, but again, I'm not going to stand there and look to see who has completed it or not. So make sure that you keep that in mind. What is required are the online components. If you don't do those, you lose attendance credit, which I'll get into. Now, that said, even though somebody's not checking, you've got to bring yourself to a higher level of accountability and make sure you get this stuff done so that you're not in danger of having to repeat the class. The supplies that you're going to need: a stethoscope, hand sanitizer, you need to bring that with you, and a pen light. Now, up until this point, pen lights have not been in your lab bags. So if they are, great, you can use them. If not, you'll just have to buy one, and they're very inexpensive, a couple dollars at Walmart or Target or a uniform supply store. As far as what you should wear to class, t-shirt or tank top with shorts underneath the clothing, or sweats, yoga pants, and a sweatshirt that's easy to remove or move to the side. You're going to be assessing each other, so the more accessible you are, the easier it's going to be. Don't wear clothes like you see on the right side that are difficult to move over so that your partner can listen to your heart or your lungs, because that's just going to make it that much more difficult. So please dress comfortably so that you're easily accessible. We're not doing anything like breast exams or vaginal or testicular exams, nothing invasive like that. But you do need to be able to pull your sleeves up very easily to a high level, pull your pants up so somebody can assess your knees, that kind of thing. I hope you've had a chance to read over your syllabus. If not, please do so. Just pulling some highlights out of the syllabus. Attendance is really important. Because it's a blended class, I am even more strict on attendance, because you've got to show up virtually in order to get what you need for the class. So I do require that you complete all of the online modules on time in order to receive attendance credit. If you forget about it, you forgot, past the due date, then you lose attendance credit because it's like you didn't show up, okay? For the daytime program, because it's only 6 weeks, you can only miss at the most 2 classes. So if you forgot to do an online lesson and then you're sick, you get dropped from the class. Okay, so save your absences for when you really need them to not physically be there. Don't use up your online attendance credit. And it has unfortunately happened that I've had to drop people, not often, but I am serious about the policy, so please make sure that you're completing your modules on time. Exams, we are going to get into specifics for testing policies, but you are entitled to miss up to one exam, or one exam, not up to, one exam per class per semester. So if you have something planned, somebody's graduation or something, and you're leaving town, you can plan for that, and you'll take your exam in the testing center at the time that you and I agree on. But you do have to let me know ahead of time. Okay, so if you leave and say, I missed the exam last week because I was out of town, you get a 0 because you didn't let me know ahead of time. Now, if you miss one exam because you just don't feel like you're ready for it, so the beginning of the semester you think, I'm going to take extra time to study, that's fine. You can do that. Doesn't matter what your reason is. You'll take it in the testing center. But then come final exam day, you are really sick or you're in the hospital or something, you've already used up your one missed exam. So make sure that if you have to use it, that it's for a really good reason and that you don't waste it for nothing, because then when you really need it, it might not be there. Audio taping and videotaping are not permitted unless somebody has been approved for accommodations. Grading for the course. The total number of points for the course, including the final exam, is 160 points. The distribution is there are quizzes worth 60 points each. Okay, I'm sorry, total 60 points. There's 2 quizzes worth 30 points each. There are 2 physical assessment demonstrations that are worth 20 points each, and then you have a comprehensive final exam, which is worth 60 points. You do have to have 75% to pass the course, and that comes out to 120 points if you're tracking your points breakdown. Okay, so keep that in mind. Just a word on grades. I know that many of you are used to getting straight A's. Maybe you've never had anything lower than an A. Maybe a couple of you have multiple degrees, possibly a master's degree, and you've always gotten straight A's. This is nursing school now. It's a little bit of a different ballgame. It is a higher level of expectations and it's difficult. So remember that you need a C to pass. So please forgive yourself if you don't get 100% on everything, which most of you won't. You just need a C to get through the program. Nobody, once you're finished and you pass your NCLEX, nobody ever looks at your grades and sees that you got a C in your assessment course. Nobody's going to care. So be kind to yourself, okay? We do have a group of nursing experts at the tutoring center that is just for nursing students, so please take advantage of that. We have a mentoring program. I'm not sure if that's going to continue, but we have had it in the past. We have a retention specialist, and we also have accommodations for students who need it for specific learning needs. So please take advantage of these resources, and I would recommend that you take advantage of these things early on before you end up in trouble, if it's something that you need. Some success strategies: complete all of your reading workbook pages in ATI before class so that you're familiar with what we're going to be talking about. Use your objectives as your guide. Please use your class time wisely. If you're given time to practice, that's the time to do it. And I'm there to give you suggestions as well. Study for the exams. Make sure you practice for all of your assessment checkoff testing. Show up for class. Check your email frequently, because I will email any communication. And make sure that you breathe. I always hate that I have to go over this, but I have to talk about civility, just because we've kind of headed in that direction with behavior. So civility is just formal politeness and courtesy in behavior or speech. So I expect everybody to be respectful to me. You can expect me to be respectful to you and be respectful to each other. I won't tolerate any eye rolling at me. If you do that, you'll just be asked to leave. No yelling at me or anyone else. Please don't sleep in class, because that is disrespectful. And make sure that any kind of interaction you have with me, any of the other faculty, or each other is polite, calm, and courteous. Okay? And also your adults and future professionals. Some of you probably already are professionals, so that is the behavior that's expected here. So what I want you to do is go to the discussion board, and I want you to post a statement that says that you have viewed this podcast and that you understand everything. But if you have questions, I also want you to put them in that discussion board forum, especially if it's something that could benefit the group. And I will answer the questions within that forum. And of course, when I see you, I can answer questions as well. But since we're missing the first week, it would be nice if we could get all of your questions answered, so that you don't have to wait. So for the discussion board, if you haven't used it before, you'll go into your course, and I know some of you are in other sections, and you're just going to go to communication and then discussions, and you'll see that I have the forum here that you can respond to. And again, I just want you to post a statement that you acknowledge that you watched and understood the Welcome to Health Assessment Concepts podcast, and then include any questions that you might have, and I will be sure to answer them so that everybody can look at them. If your question is personal in nature, please email me. And that concludes the introductory video for your course. Please let me know if you have any questions. And again, thank you for your patience. This is not the optimal way to start, but I didn't have any choice. So I look forward to meeting all of you.